Hello and welcome to the Healing Point Info Session. I'm Dr. Eon Suhanee, and today I would like to talk a little bit about using acupuncture to manage your anxiety. What is acupuncture? Well, acupuncture is an evidence-based Eastern medical treatment that survived the test of time. Emerging studies of acupuncture date back to 2500 BCE in China. Acupuncture is specifically referring to the use of thin needles inserted at specific points along the body that correspond with treating your individual case. While traditional needles may be thick and painful, it takes about 20 acupuncture needles to fill in one hypodermic needle. That's just to gauge how thin they really are. And these specific points are along what we call a channel or a meridian. It's how we categorize each point and use the most appropriate group for your needs and complaints. So, what if I don't like or I'm afraid of needles? While we are still working with needles, acupuncture needles are usually painless and rarely even produce a drop of blood. But we have a myriad of tools aside from the needles that we use in our treatments, including acupressure, ear seeds, cupping, or the use of herbal formulas to continue the treatment outside of the office. How can acupuncture help my anxiety? Well, let's look at science for this answer. A double-blind randomized parallel clinical trial found that just after 5 sessions of acupuncture was effective in managing and remedying traditional anxiety symptoms. This is independent of individuals' use of an anti-anxiolytic medication. This goes for the use of non-electric and electric stimulated acupuncture called electroacupuncture, both of which showed effective in treating relative symptoms by the 10th treatment. The goal of the study was to evaluate the effectiveness of acupuncture and electroacupuncture in the treatment of anxiety through a score system to determine the anxiety levels by the application of the anxiety skills, BAI, GAD, which is the Beck Anxiety Inventory. GAD is the Generalized Anxiety Disorder Questionnaire of 7 items, and OASIS, the Overall Anxiety Severity and Impairment Scale, as well as thorough measurement of the salivary cortisol values. What if you're already taking a prescribed medication to manage your anxiety? Thankfully, in this study, the subgroups of people who were already taking anti-anxiety medication were measured separately and still found that the results of those receiving acupuncture treatment were not statistically different than those who were not taking medication, confirming the use of both acupuncture and electroacupuncture to be effective, whether the recipient were on an anti-anxiolytic or anti-anxiety medication or not. Well, in some ways, in addition to our treatment, we add mindfulness or meditation to our treatment. Following an acupuncture treatment, I recommend that my patients take 15 minutes to sit at the back of my office where there's this nice little waterfront. Currently, we have a couple of swans and cygnets swimming around. Other studies have found that just after one meditation setting and session of being mindful and present, MBSR was associated with a significantly greater reduction in anxiety as measured by the CGIS, CGII, and the BAI. These are all diagnostic tests as far as measuring anxiety-related symptoms. Thank you so much for your time. I hope this short video was insightful enough for you to be able to add to your repertoire of different things that you use to manage your own anxiety. I'm Dr. Eon Suhanee, and if you found this helpful or may know someone who may use this information, please like the video and share it with a friend. If there are any specific questions you have, feel free to drop them in the comment section or find more interesting information like this on our website, thehealingpointli.com. Thank you and have a great day.